I would like to take this opportunity to introduce you to our state-of-the-art intensive care cot, with every feature focused on infection prevention, child safety and ease of use. In the critical care arena, where children's immune system are more challenged and there are more invasive procedures, it is even more critical to make sure that we maintain a clean environment. The first thing I'd like to show you is the 4-section electric platform. To increase the head-up position is a one-touch button control, which allows you to get the child into an ergonomically suitable position to maximise pulmonary function and to get them in a comfortable position. At the same time, you can create a knee bend, which is a useful tool to prevent the patient sliding down the bed, creating shear and friction forces as they move down the platform. It also allows you to mobilise the knees in an upward position, which helps vascular return. The functionality of the product can be manipulated through the hand pendant, which allows you to get the head up position and the knee bend position. All other functions of the product are accessible from the foot end of the bed. All the electric functions are accessible through this foot control panel. From a safety perspective, each individual electric function is lockable. In addition, you have a 2-button action to manipulate any of the electric functions from a safety perspective. The head down tilt will allow you to get head access if the child has a situation where you have to get head access and manoeuvre blood flow to the head. You also have the facility to get a foot down position, which helps to get more of a seating position if the patient has respiratory problems. In addition, accessible from the base, you are able to increase or decrease the height of the product, which allows you access to your child without bending or stooping and creating problems to your carers' backs. The intensive care cot also comes with a choice of foam surfaces. The foam is designed to prevent pressure and therefore prevent the risk of tissue breakdown. The foam is developed with cut cubes to allow the patient, when they lay on it, to sink into the foam, distributing their body weight over a larger surface area, therefore minimising pressure and minimising the risk of injury to the patient's skin. The safety rail provides a safe environment for the patient while they're in the platform. If the side rail is to be lowered, it is easily lowered with one carer in a rotation down mode, which allows direct access for the nurse into the patient. The safety rail is made of a plexiglass material which has several benefits. The first benefit is that you have complete visibility to your child, depending on where you are in the ward. Also, if family are here, they have access and they have complete visibility of their child. The other advantage of the plexiglass side rails is from a cleanability perspective. Any blood spills or milk spills on conventional rails are very difficult to find and very difficult to clean. However, on the plexiglass, it's always visible, and one wipe down clean with your hospital protocol means that you've got a visible, clean surface, which will help to prevent cross-infection. Another benefit of this cot is that you have the ability to have a 360-degree accessibility to the child while they're critically ill. Often patients who are very critically ill have a lot of lines and tubes, and clinical teams ask us for the ability to have 360-degree access. The side rails rotate down, as you saw. You also have the ability to take off the head and footboard. The unique ability of this cot allows us to place an X-ray plate underneath the platform, underneath the patient's sleep deck. Once it's placed in position, the child can be lying in the supine position, and then the X-ray plate can be easily manoeuvred the whole length of the patient's body, allowing stress-free, hands-off X-ray procedures. The X-ray plate that's situated behind the platform and underneath the child has the ability to customise the size depending on the X-ray plate to be used. This cot also has a CPR lever, which is situated under the platform at the back at the head end. It's a one-squeeze action which flattens the sleep deck, allowing you to start cardiopulmonary resuscitation quickly and safely. We've talked a lot about the need for an easy-to-clean product to prevent cross-infection in the paediatric environment. We've talked about the ease of cleaning the side rails, but to also point out that underneath is made in a one-piece moulded plastic, ABS plastic, which is easy to clean. There's no joins or crevices to harbour infection. Another aspect is that all electric components of the product are IP66 rated, which means that they can be wet and they can be steam cleaned. This product also comes with the option of highly accurate weigh scales, OIML compliant and class 3. The weigh scales allow you to get exact weight measurements of your child, which helps in the calculation of drug dosage. This product also comes with a wide choice of accessories, from IV poles situated either at the head or the foot end, monitor table holders. All accessories are easily fitted into the sockets, either at the foot end or the head end of the bed. There's usually a lot of equipment that needs to be carried with that child. We have another product which fits snugly onto the foot or head end of the intensive care cot, which is called a transport system. This transport system can be configured in whichever way suits your clinical environment or the products that you're transporting. It will then fit easily and snugly over the head end or foot end of the intensive care cot, and then be safely mobilised with the cot from ward to theatre or back again. This creates safety at all times. It ensures the equipment required for that child is situated in one safe, easy place, and you haven't got equipment lying round the platform and round the patient, creating risks, as is often seen in the clinical environments today.